Hello and good evening, everybody. It is now 5 o'clock, which is the stated time for us to start. I see more and more people are continuing to join, so I ask that we give them 5 minutes and I will be back after 5 minutes. Karibuni sana, we are very happy to have you here. Hello, everybody, and karibuni sana to this evening, where we will be talking about revitalizing Kenya's economy, and particularly beginning the conversation on Buy Kenya, Build Kenya. My name is Charity Kamau. I will be your moderator for this evening, and I currently serve as the head of program for the Kenya Healthcare Federation. Before we go any further, I would like to invite Dr. Tom Menge to open for us the meeting. Karibu sana, Daktari.
Thank you very much, Charity, and Thank you so much for the participants who joined us. This is the beginning of many discussions that we shall be having. And I look forward to today's engagement and the possibility of many more seminars like this, so we can be able to speak frankly to one another in the space of increasing the capacity of local manufacturing products and technologies in Kenya. Thank you, and over.
Asante sana Daktari. We will hear a lot more from Dr. Menge during this conversation. Dr. Tim Theuri, would you like to give us some opening remarks as you also introduce yourself? Dr. Theuri, if you can hear me. Okay, as we wait for Dr. Tim, Sylvia, are you there?
Yes, I'm here, Charity. Okay. Greetings to you all. My name is Sylvia Wamohu. I'm the Chief of Party for the USAID Private Sector Engagement Program. This webinar has been made possible by USAID, who has generously funded the USAID Private Sector Engagement Program. So the USAID Private Sector Engagement Program focuses on enhancing health outcomes through supporting the private health sector. And we do this by collaborating very, very closely with the government of Kenya. We are supporting 5 health areas: HIV, FP, malaria, TB, and MNCH. And why we are doing this is because we know that Kenya has a health mix system. 54% of health facilities in Kenya are run by private healthcare providers. So there is no way we can wish away the private sector. We are focusing on 3 main things. The first thing is to support the private sector, and as I mentioned, in collaboration with the government of Kenya, to increase the number of products and services that are offered through the private sector. Why is this important? We know that Kenya has been relying a lot on donor funding, but this is changing. So the private sector has an opportunity to grow their business and to also increase their contribution in the health system. The second thing we're focusing on is quality. And the third thing is local manufacturing. And that is why we are here today. So what opportunities do we have as the private sector to support our country to just make it a reality in terms of achieving our 4th UHC pillar, enhancing local production? So we are working very closely with the Directorate of Health Products and Technologies, and thank you very much that Dr. Menge is here today to just see how do we get there. All of us putting our hands together, the government, the private sector, implementing partners, and therefore this program plays the role of an implementing partner. I'll not say much, but thank you very much, Dr. Menge, for joining us. Thank you very much, Dr. Vimal Patel, for joining us, and thank you, Charity, for moderating the session. Feel welcome, and we're very excited to have you here today. Thank you.
All right, asante sana, Sylvia. Dr. Theuri, would you like to say hello?
Hello, everyone. Mine is to welcome all of us into this webinar. I really appreciate the attendance that we have today. I think Sylvia has brought out very well what the program is about. For KHF, our role is to organize the sector, which we have traditionally done. But this time round, we want to pay focus to some key areas. Local manufacturing is one of them, and the key takeout at the end of the life cycle of this program will be to provide an enabled business environment as a first thing. The second thing would be to see an increase in the number of products the country has. The second thing under that sub point would be to have in-country sufficiency best we can for the products that are in the essential medicines list. And thirdly is to hopefully see all of this offered to Kenyans affordably, efficiently, and throughout the entire country. That said, this fourth star, but UHC has commodity security as one of its pillars, and I think it's something that we must be able to crack as Kenyans as we are going through the UHC journey. Because without commodity security, it is very easy to end up with care that is affordable but easily unavailable, because commodities, or rather health products and technologies, account for a significant portion when it comes to what they contribute to the bill at the point of financial discharge for our patients. To the Directorate of Health Products and Technologies, headed by Dr. Menge, thank you for being a valuable partner in this journey. We've had very many collaborative engagements, and I really would want to applaud your leadership at the ministry in this area. To Dr. Vimal, we'll be happy to hear you today. You've also been a great partner leading the manufacturers. And I really hope as Kenyans who we are all attending here, we are able to buy Kenya and build Kenya, because that's the only way we are able to ensure that things move. The products we have in the country, I can assure you, are of good quality. They are affordable. We've had tours to these manufacturers where they're manufacturing from, and what I've seen has also surprised me, because pick these factories and put them anywhere in the world and they would fit in perfectly because they've put in the work. We have in-country technical people who are employed there and working, and we really hope that we can participate in this journey of buying Kenya and building Kenya. Thank you, Charity, and over to you. Dr. Gakombe passes his regards. I am sure he will be joining us. He's our chairman. If he's on the call, you will allow that we will call him up and he will give his remarks. Thank you so much, Charity.
Okay, asanteni sana to all our greeters. I hope we all feel welcome and wanted, and that we are ready to engage in this conversation. The people that have spoken before me have said a lot of the keywords, or let's say the mesh terms, if we were doing a PubMed search, that this conversation is about. And it's about how do we increase, first of all, the visibility of what our local manufacturers are doing. How do we increase how much we buy from what is made locally? And by so doing, how do we achieve commodity security, which is one of the pillars of universal health coverage? We hope that this is the first of many conversations. And so if you allow me, I would like to go very direct to introducing our speakers. But I will allow Dr. Gakombe to say hello, because he also presents a very interesting perspective that sets the tone on the part of the providers. Dr. Gakombe?
Possibly see if, okay,
Yes.
he's there. Thank you.
I am here. I've sorted out my technology challenges. Good evening. I too am very pleased to be here. This is a very, very important subject to not only KHF, but for Kenya and the region, because there are certain lessons we've learned and we should never, ever forget them. We learned during COVID that commodity security is really a matter of life and death, that there are those seasons where you have to be self-reliant, and the alternative is a very, very dire circumstance. So it is important as a country, as a region, as Africa, that we are self-reliant as we can possibly be, because our lives truly do depend on it. The second point I want to make is that this journey that we started with USID and with MOH became a personal challenge for me. And I came back and began to look at data on how much we actually do buy locally. And I'm embarrassed to report that I realized that on pharma, We were only doing 2.8%, with India taking 38%, and followed by other countries. So I am trying to grow Kenya's share of wallet, because now I have the numbers, courtesy of Dr. Menge's challenge, and we are tracking them, hoping to go to twice as much, and then we continue to build from that point. And I would ask all of us who are here, who are buyers, that we actually look at our numbers and take a deliberate strategy to buy Kenya, to build Kenya, because it's important. Our sons and daughters are on the streets, and one of the fundamental challenges is lack of opportunities. And opportunities for our youth, who are our greatest asset as a country and as a continent, one of their biggest challenges is opportunities. They have energy, they're educated, the opportunities are limited. And we are not going to create opportunities for them by exporting jobs. We're going to create opportunities for them by growing our economy, increasing our manufacturing base, growing our private sector, so that we can absorb them, because we long ago agreed that the engine for growth for our country will be private sector, will be the creator of jobs, the source of access to support government services and programs, and that won't happen. Healthcare ecosystem and other ecosystems. Not. Finally, I want to say that there is an opportunity for our manufacturers, because the advent of and the growth of social health insurance increasingly means that even as we raise more money to meet our healthcare needs, we also must look at the cost of the commodities and the resources that we use. And social health insurance, and increasingly even private insurance, is taking the route where providers are paid a fixed fee for a certain quantum of services. And that basically means that all the inputs become a cost against a fixed income, and providers therefore have to shop very wisely for quality products that are cost effective. Otherwise, they'll be losing money. So I would want that we take full advantage as an industry of that change in the payment model, which will continue to be dominant as the years go by, because we have 56 million people to look after without a lot of money. So we must make the money go as far as we can. That we can only do by working together as an ecosystem. With those few remarks, I will step back and listen to our able panelists and learn and get new challenges to take forward into the future. Thank you.
Thank you very much, Daktari. It's always a pleasure to have you in our midst, having been in the healthcare space for a very long time. Without further ado, please allow me to introduce our panelists for today. Our panelists, we have two. I will start with Dr. Tom Menge, who is currently the Chief Pharmacist and Head of the Directorate for Health Products and Technologies, which is part of the State Department of Medical Services under the Ministry of Health of Kenya. Dr. Menge has over 28 years experience in the industry, starting off with bachelor's in pharmacy and finishing with a master's of science in pharmacology and technology, and in an area of which he's also an honorary lecturer in. Dr. Menge, as you have had alluded before, has been very instrumental in advancing healthcare policies and public-private partnerships in this area of local manufacturing and beyond. He has a very, very good knowledge of the manufacturing landscape, and he is one of the best leaders I have seen. And he brings a lot to this conversation. His wealth of knowledge, his academic expertise, and his articulation of issues. So, karibu sana, Dr. Menge, if you can put on your camera.
Thank you very much, Charity. And once again, I just look forward to a very fruitful discussion. Thank you.
Okay, I will ask that you keep your camera on since now we are entering the panel. So imagine you're there at the stage. After, I would like to invite Dr. Vimal Patel, who is really who we are talking about today when we talk about local manufacturing. He is the Managing Director and CEO of Cosmos Limited, which is one of our local pharmaceutical manufacturers. In addition to that, he is also the chair of the Federation of Kenya Pharmaceutical Manufacturers. So he represents a group of people. He's a highly respected leader in the pharmaceutical industry with over 30 years of experience. And he leads Cosmos, which is one of the largest pharmaceutical manufacturers, and has been very pivotal in advancing the production of essential medicines in Kenya, particularly those of the high burden communicable disease areas. And under his leadership, we have seen a lot of growth, both of the industry, but also of Cosmos as an organization, but also generally of the pharmaceutical manufacturers. Dr. Vimal is a great advocate for the Buy Kenya, Build Kenya. And as part of this, he has been involved in the writing of a lot of policy documents and support in shaping how the market and how the national and international organizations see local manufacturing in Kenya, but not only in Kenya, also beyond. So we are really, really privileged to have you here with us, Dr. Vimal, and we look forward to a very engaging conversation. Karibu sana.
Thank you, Charity, Tim, Dr. Gakombe, and Tom. What can I say? Too much flattery words for me, right? So thank you for all that flattery. But I'm so happy to be invited. And I think it's an opportune time that we had this sort of discussion, because at the end of the day, as you say, it's Buy Kenya, Build Kenya. And the patients are the most important. And we've got 2-3 stakeholders coming together for the benefit of the patient. So it's very good and engaging. Thank you very much.
Okay, karibu sana. Martin, I don't know if it's my view, but if you could just remove the poster and have the panelists, maybe just the 3 of us side by side, it's okay. I would like to start with a few moderator-directed questions. Everybody else, all the people in attendance, please put your questions in the Q&A section. And I would like to start with Dr. Menge. I know that your department is tasked with having an overview of the local manufacturing and of promoting and driving this agenda from the government side. Could you please start by giving us an overview of the current landscape of local health production in Kenya? You're muted, Doctor.
Yeah, thank you very much, Charity, and thank you, participants, once again for the overwhelming presence in this webinar. You've asked me to just give an overview of our current landscape, and this is mainly guided by an evaluation that we opted to do early this year, because we wanted to know where are we at, what can we talk about the current landscape of pharmaceutical manufacturing, specifically pharmaceutical, but we are hoping that we'll be able to open it up to the general landscape of health products and technologies. So where are we today? We decided to do this evaluation and assessment to first of all describe and find out what are the kind of establishments that we have in the country for manufacturers. Where are they located? What type of business is it? How is it owned? What are the product ranges that are locally produced? We then went ahead and asked ourselves, are the products that are made within the pharmaceutical sector, are they relevant to us, especially when we look at what our essential medicines list looks like? And therefore, we've been able to go into a lot of detail to look at the product formulations that are manufactured locally. How do they correspond to our essential lists of pharmaceutical products. How do they respond to the healthcare needs of our current needs? How do they respond to the main disease burdens that we have in the country? Are we producing for our disease burden, or are we producing for another area? And therefore, for us, it is a very engaging report that we've been able to look at. We have a clear idea of where are our capabilities. We've also gone ahead, Charity, if you'll just allow me, to look at the capacity utilization within our pharmaceutical industry. We've asked ourselves, what are the production lines? What are the potentials that the pharmaceutical industry has of expanding to other areas? We've looked at the human resource elements and answered the question, do we have enough human resource? And if we have human resource, are we utilizing them? What about the quality assurance systems? We've also had an opportunity to look at the challenges and listen to the manufacturers and find out about the challenges that they have. And as a ministry, answer the question, are we able to address the challenges? So we have a clear understanding of where we are in the pharma sector. Thank you.
All right. Thank you very much, Dr. Ari. I think that sounds very comprehensive. Are you able to speak to some of the areas that your department is addressing to help facilitate local manufacturers, to help facilitate market access for local products?
Yeah, so some of the findings that we were able to identify is when you look at our essential medicines list, and you'll allow me to just focus on the medicines for purposes of this webinar. Yes. Now, we have close to 800 products, 890 products that are in our essential medicine list that constitute more than 1,070 formulations. Through the assessment, we actually found out that we are currently producing 20% of our essential medicines within the country. So an opportunity. We have 80% of our essential medicines not being produced. But we're also able to find out that if you look at all the products that are manufactured by the local manufacturers, 67% of those products are not within our essential medicines list. We are therefore we're able therefore to give a lot of guidance for the growth of the pharmaceutical sector and say these are the gaps that we have. We've been able to look at the capacities. We've done a national quantification exercise, and we know what are the public health needs in the area of medicines. And therefore, if somebody comes into the country right now with an idea of setting up a pharmaceutical factory, we're able to give proper guidance and say that these are the gaps that we have, and we can be able to move forward. The other thing that we've been able to do significantly this year, and we're hoping we'll take it to the end of the process, is to encourage public procurement agencies in the meantime to focus, if something is in the essential medicines list, if something is locally manufactured by at least 3 manufacturers, then we have developed what we call a preferential procurement list that we expect then public entities to respond to, that for those things that we've shown demonstrated capacity, we'll preferentially procure them from our local manufacturers. Thank you.
All right. Before I let you go, Dr. Ari, one of the first questions that comes up when you mention a Kenyan product is the issue of quality. What can you comment from where you sit about the quality of locally made products?
It's very interesting to be a Kenyan because if you go to the surrounding countries, and actually most of the African countries, they highly regard products that are manufactured in Kenya. They come to us for the quality of the products that we have. The second area I want to look at is the regulatory framework that we have. And while we're doing this assessment, we were evaluating initially about 41 pharmaceutical industry. Yet out of those, about 6 of them were under some corrective action by our regulator. And therefore, one of the requirements in the local pharmaceutical industry is that you have to have a good manufacturing practice license. And that is a very stringent way of looking at our products. Therefore, the regulatory landscape is right. There are other initiatives that are both local and also international that will form the basis of an evaluation process that can be able then to assure the quality of those products. I was challenged a few years back, and Vimal kindly allowed me to share this, by Vimal's father. He is late now. And I remember he told me that all his medication that he was taking at that time were manufactured at Cosmos. And I thought that that is somebody who believed in the product that he manufactures. So in terms of quality, there are regulatory processes, there are assurances that have been put in place. And whether we are convinced about it or not, every country surrounding us really believes in the products that we manufacture locally. Thank you.
All right. Thank you very much, Daktari. Quite a powerful message there and quite a good overview. I want to come to you, Dr. Vimal. I will ask you at some point to react to the 20% of the product, so how that works. But to start with, I'd like to hear from you about FKPM and some of the things that you are doing as FKPM.
Okay, so FKPM stands for Federation of Kenyan Pharmaceutical Manufacturers. We're a group of companies. I think we got about 27 members, 23 members. And the idea of forming the association of FKPM was that if we wanted things to be changed, the policies to be changed, address our needs, we all know that organizations with membership has a better clout than individuals going to the ministry or something. So it was formed for that purpose. The purpose was for policies and also for our own selves to gear our industry to a world-class industry. How do we go from what we are today to a world-class industry? Yeah? And we all know that is there because the world is opened up, there's internet, people fly around, people expect the same things they get all over the world, the same Kenyans expect the same. We're all human beings at the end of the day. So those are the things on the basis on which FKPM was made. Yeah.
All right. Can you tell us about some of the, an overview from the manufacturer's point of view of the strength of the local manufacturing, and we will stick indeed to pharmaceuticals for this. In subsequent webinars, we will have a different aspect of health products and technologies. What you feel are what you see are the strong points of the local pharmaceutical manufacturing, and as well as what are some of the challenges?
Okay, so it's a very good question. I think the strengths is there because when Tom said there are 34 manufacturers in a country of population, I don't know, between 40 to 50 million, yeah, it shows that the ratio. When you look at the other East African countries like Uganda, Tanzania, Burundi, Rwanda, club them all together and still Kenya's got the biggest number of manufacturers. So something is right here, okay? It means that we as a country are a bit more advanced than our neighbors. Our workforce is that much more educated. Our workforce is that more intelligent, hardworking. And then maybe we had the entrepreneurs happen to be in Kenya because of its stability, yeah? So I think that is a good strength in terms of what we are in terms of the industry, yeah? And sorry, the other question you asked me was what?
What are some of the challenges? Yes.
Okay. So the challenges are very simple, yeah? I think the challenges that we face are quite a few, but I will talk about the main challenges, okay? To me, the main challenges is we always talk about India, we always talk about Bangladesh, things like that. But we don't see that these countries in 63 and later on, of Bangladesh, they changed their policies. That's why India is what it is and Bangladesh is what it is. So what do I mean by these policies? Yeah. Today, the government policies do not encourage local manufacturing. Anybody who wants to put a factory will think on the return of investment. Let's look at first and foremost, all medicines come duty-free. Yeah. Now, if you're having local manufacturers making these medicines, why are you bringing duty-free medicine? How are they going to grow in terms of market shaping? Yeah, there's no volumes. So when the volumes are not there, the revenue is not there, the profits are not there. Okay, so that's one. The second thing, look at the VAT Act. The VAT Act says it moved from zero rating to exempt. Now, what does it mean? That every time the manufacturers put up a plant or they have other utility costs, all that VAT they cannot claim back. It's a cost to them. So it doesn't help manufacturing. In fact, we're more of an Akumet where we import the products and sell to the market. Yeah. And we are, as Dr. Gikombe said, you know, what about our youthful force? Where are we going to keep these guys employed? Tim mentioned about security. What are we thinking about it? That's where the problems are. I think, to me, those are the main things that we need to address. Yeah.
All right. Thank you very much there. I would like you to make a comment on the types of local products. So the range, so to speak. I think, so if we say I think we have the essential medicines list as our guide, and 20% of that is produced locally, vis-a-vis 67%, which is not in the essential medicines list, but is produced locally. What informs that decision, and what can you tell us about that? And how do we move? Is there a desire to move to encompassing more, and how do we get there?
You know, thank you, Charity. I think those results that Tom has mentioned is quite striking. And I never knew that, okay? Because as a manufacturing association, we never looked at it. I think the medical medicines essential list has got updated recently. So one of my topics I'm going to take on is sit with the association and understand why is it only 20%. Yeah, because when you look at government being the biggest buyer in terms of 60% of medicines for the government is a buyer, then where are we positioned as such? Yeah. So I would like to study that before I give my comments. One of the things that I possibly thought, why is it this way? It could be a number of things. What kind of dosage forms do we make? Yeah, so in the essential list, there are lots of different dosage forms. So I'll stick to, say, solid dosage forms. It could be that we don't have actual numbers of what is required to go into the see market shapes itself from what the private sector demands and what the government buys. So maybe some of these tenders were floated but not economically viable when you compare to imports. Yeah. Okay. But you know what? At the end of the day, I think it's a very interesting thing to look into. So this is one of the first things I'm going to do, because this has been mentioned a number of times. And in fact, the other day I was just going through the list and I was trying to see it. Yeah. So I think that's an interesting point. Yeah. Coming back to the point is, I'll talk about Cosmos here, and then maybe the other companies will talk about their own things. I'll come on that. Yeah. But you see, in Cosmos, we first started with the pandemic diseases and endemic diseases like malaria, TB, HIV. In fact, we were the second company in Africa to get a voluntary license from multinationals, and we did supply it to Kenya government. Yeah. But as time went, you know, the donor funding made it very difficult for Kenyan companies to get tenders, right? So we then decided, are we going to be in this business? or are we going to go to another disease which is coming in, which is the NCDs? So we started concentrating a lot on NCDs. And I know there are few NCDs which are in the essential list, but I guess everybody saw the private market where what are the kind of products the private market needs rather than the government, yeah? Because the government is a very risky business, yeah? So in the sense that first it's tendering, then it's the lowest pricing, you don't know when you get paid. So it's a risky business, yeah? So I think there could be those other reasons, but one needs to really understand from my membership and everything, yeah?
All right. Thank you very much. I think quite interesting insights. Like you, I'm also learning a lot. Someone says we add volume. I hope, Teresia, you can hear us. Dr. Menge, also picking up from a question that was put in the Q&A, how can we get access to the report that you mentioned?
Thank you. And I know this is an interest for everybody. I just want to give assurance that once we get the go-ahead to distribute it, and I think it should happen within the course of this week or next week, we'll be able to make it available to all the members. So I just want to give a commitment that in the next 2 weeks, the report which is ready will be available as a public document. Thank you.
Okay. Thank you very much to both our panelists for that overview. You see also on your screen some industry statistics from a presentation that Dr. Vimal prepared. I don't know, Vimal, if you want to highlight any particular thing on this slide or the next one. Over to you.
So I think if you look at that slide, 60% is imported, yeah? And those are generics. Now, if they're generics, why can't Kenyans take Kenyan generics? Yeah, what do we need to do to shift our people to take Kenyan generics? So there is a bit there. Now, 70% is imported in terms of value, not numbers, which then says that, you know, if we get another COVID or something worse than that, where is our population going to be? Yeah. I remember that most of the industries were running during COVID time. They never shut down. We had the stocks of azithromycin to supply, etc. And that's the beauty. When India closed down, we could manufacture because we had those stock holding of raw materials. So I think looking at all that and the job creation, I think that's only one way to go. I mean, the medical fraternity is looking at why are we going to India for medical tourism, etc. We can do it in Kenya. Yeah. Why can't we do the same thing of pharmaceuticals here? It's Kenya. We're talking about Kenya. So I think that's where I look at it. And I said, you know what? The youth are coming out of university. They have a lot of aspirations. The community has a lot of aspirations. They send somebody to be educated. They will get revenues. They'll get a job. They don't get a job. And we are exporting our jobs to India, Pakistan, and China. I don't understand that. Yeah. So I think those are the things that we really need to focus on.
All right. Thank you very much. I think we have a good overview. Martin, if you could please put on the next slide and then we can just have a look at it. And now I want to go to about the Buy Kenya, Build Kenya conversation. And this is a question to both our panelists. What, in your opinion and experience, are the main barriers to the adoption of locally manufactured health products? I think some of the things have been mentioned, but maybe we could expand that conversation. And maybe we can start with you, Dr. Menge. What are some of these barriers? I know you have been a pharmacist in a hospital, and you have been in this sector for a long time. What are some of those barriers? Why are we as Kenyans, both as individuals, when I walk into a pharmacy, I say, in your Germany, and as CEOs of hospitals and other institutions, why are we not automatically or more readily buying Kenyan?
Thank you, Charity, and I'm afraid I can't be seen on video because the screen sharing is on my profile. But
okay.
So why aren't we buying Kenya? Thank you for that. Now, why aren't we buying Kenyan products? And for me, the main thing is what Vimal referred to. We have a lot of imported health products and technologies. And because of the various advantages that importing a product within the current scenario does, you find that it is much more competitive for most of the, especially the public hospitals that go through a public procurement process, to find that the Kenyan products are very good, yes. We've not had policies that have encouraged us to preferentially buy from them. And therefore, if you look at the costing, because some of the countries we bought from have got the advantages of volumes that they produce, because they're not just producing for a region, they are producing international volumes, and therefore the cost of production is significantly lower. And therefore, a Kenyan product competing with a product, let's say from China or India or even Bangladesh, will be a bit disadvantaged because the overall production cost and therefore the cost to the market will be significantly higher. Those are some of the things that we're able to identify in the assessment that we've done. And it's important to say that because of that, we have actually been given an opportunity to present our findings to the Economic Council so that we can be able to, as a government, look at policies then that could encourage the environment in Kenya to allow the products that we are producing to be competitive. I really believe it's because of the cost factor, and I'll want to hear Vimal's reaction to that also. Thank you.
So can I go, Charity?
Yes.
Yeah. Okay.
Yes.
So I think Tom is right there. He knows it better from his years of experience. But there's another factor. When you export from India, there's export rebates, etc. All the countries protect their own economies. Yeah, we don't get that kind of protection. And earlier I told you about exemption of VAT, right? So if I do an expansion or I have VATs, I can't claim that back. It's a cost, so I have to build it in. Okay. The second thing is that if you have, I think there are almost quite a lot of imported products of the same item, so many imported. All that coming from India or China against a local, it's always going to be diluted. Always going to be diluted, right? So that's why you associate Kenyan companies to imported. But if you look at individual and you compare, say, one company to another from the overseas, then you say, why is this company far less than the other? But it's all about market shaping. And I think as long as you have that, opportunities are going to be limited. FDIs are going to be less. Yeah. And we're all talking about India. But you know what? We're sick and tired of India. Let's start doing what Kenya needs to do. Kenya be the India of Africa. That's what my saying. Let's be India of Africa. Let Kenya be India of Africa. As simple as that. So that's one of the things. I think the second thing is that I think even in my childhood, yeah, anything imported you thought was a wow factor. You know what I mean? Okay, but that was my childhood. Today it's two different things. So I think sometimes we come from our upbringings or our cultures that think it's always there. But in reality, you know how many manufacturers there in India? There are almost more than 50,000. I've seen some of those factories, and they are nothing compared to what we are. It's only you see the package and you get disillusioned, or it's an imported product. Yeah. So I think we need to move from there. On the other hand, I would also say positive things. Yeah. I've seen a lot of Cosmos products, a lot of other companies' products from the membership of healthcare being accepted. Then itself is saying something, right? So it's coming. Yeah.
Yeah. All right. Thank you very much. I think those are quite good perspectives. Dr. Gakombe, I don't know if you're still on, and maybe you could allow me to bring you in. And you mentioned something at the beginning about the analysis you did to see how much are you buying locally. Do you have any insights on how that became so? What were the things that led to the choice of not, it's automatically Kenyan?
Thank you, Charity. There is a paradoxical problem. You know, the way pharma has worked here in Kenya is price plus markup. So if you are buying products of 10 cents or 1 shilling or 5 shillings, you do markup of 33%, you cannot run a pharmacy on a high street. Okay? So one of the disadvantages in a market where it is price plus markup of a quality, low-cost product is that it is not attractive from a commercial economic perspective. That's why I say one of the greatest opportunities, right, is that the reimbursement model is changing. We are moving away from fee for service. Because traditionally what has happened, especially in hospitals, I ran to is it's price plus markup, right? So you basically will have a higher bill if the inputs are expensive, right? So that is changing, and that means all of us have to go back to the drawing board, focus on our supply chain, because success will come from the organization that finds quality products, because the patients keep coming back with the same problems and soon abandon the organization. So you have to provide, and at the same time, it has to be cost effective, because if it's not, then you have a loss. If you look at what NHIF was doing and SHA will continue, you are paid a particular amount for capitation in outpatient, you're paid a particular amount for hip replacement. So the price of the inputs becomes extremely critical. So expect that there will be a retooling and re-engineering of supply chain management in many organizations to now find alternatives that are cost effective. The other reason is that Vimal and his brothers and sisters can make and are making good quality products, but their capacity to market them is not as high from where I sit. That's changing as the multinationals, whether they're from India or Europe. So doctors get used to particular products. They do not have the capacity to do testing and vetting. So when you lack that capacity, then you go for the original brand. Yeah. So the capacity to assure quality, that when you see a KEBS stamp, when you see the PPB registration, it is good, is a very, very important assurance to prescribers, because as individuals, they have to rely on those symbols of quality from a third party. And generally, and Vimo has alluded to it, if it's coming from Japan, it's good quality. If it's coming from Europe.
Yeah. Yes, thank you very much. I'm just thinking that this is a good moment to do.
Factors.
Sorry,
There are
yes.
multiplicity of factors, but Once they are addressed by raising our regulatory capabilities, improving the packaging of local.
We are losing you, Daktari. I think you're muted. Dr. Gakombe? Okay. I think we got from I think we got quite some good insights, and I think the ability to
is the modeling of how care is reimbursed for. That change will create a very, very significant opportunity for local manufacturers, and we must prepare for it. Everybody must prepare for it. Providers, manufacturers, supply chain, we must be ready for that transition.
All right. Thank you very much, Daktari. Highly appreciate your insights. So now I would like to go to the questions that have been yes, Dr. Vimal. Before we go,
I think I've heard a lot of things are centralized around quality. Yeah, quality. Yeah. I can only tell that, you know, first and foremost, you know, we are regulated by PPB. Yeah. And there's an able body like Tom Menge says, and they come and inspect and they check our products, our dossiers, etc. A lot of the other companies within the FKP memberships have gone further beyond that. Universal is WHO pre-qualified, Cosmos, Regal, I think Lebanelite, they're PICS. Compliant PICS means they're European inspectors who come and inspect. Yeah. What I would think a good model is that we as membership should create sort of a system where some of the doctors can come and visit our factories, you know. Seeing is believing. See the kind of stuffs we do. Yeah. And, you know, even some Americans are very ignorant. They come all the way to Kenya and they think Kenyan pharmaceutical factories are in a garage. So I think seeing is believing. Yeah. Second thing is that, you know, there are a lot of companies that make hypertensive, diabetic drugs, etc., etc. And I always say to everybody, even within Cosmos, that testing is not a solution. Building your production and doing things consistently, properly is the solution. The biggest testers are going to be the patients. If the blood pressure is not regulated, the sugar is not regulated, you're out of the market. So, you know, it's very, very important that a mindset is like that. And the local manufacturers are looking at that mindset, yeah?
All right. Thank you very much. I see we have 693 people on the call, and I hope we are still all together. I'm wondering if we could all just type in the comment, what is it that you would need to be able to preferentially for yourself buy local products? What is it that you need? What question do you need answered? What mark do you need answered? Because one of the things, so in preparation for this, I looked around my house to see what medicine I have. And actually, I only had two packets, one of Panadol and one of Maramoja. And I said to myself, why didn't I even think to look for a Kenyan product? Because on the shelf in the supermarket where I bought it, there was just these two. And I don't even look at the name necessarily. I just look at the color. I know one is blue, one is red. And I move on. I have seen some of the snack manufacturers now, like Chevda and a few other things. They now have a Kenyan flag somewhere on their pack. And actually, you know, you just pick the Kenyan flag and you're out, you know, and I wonder if that is if that is the things we are talking about. So for me, I will put in the chat that what I would need is a mark of identification that this is a Kenyan product. Now, we also know that counterfeiting is also a challenge, but I think that we can do step 2. But I feel like for me, that is what we would need. So please, I encourage you as we begin to take your questions from the chat and the Q&A, if you could please put in what do you need, because I feel a lot of action points coming out of this, which we are taking note of, and this is the first of many. Dr. Menge, I'd like you to take 2 questions from the Q&A, and one of which is, what deliberate steps has the Kenyan government taken to ensure that any would-be consumers within Kenya buy Kenyan commodities unless the products cannot be made in Kenya? I see this happening with most of our neighboring countries, even though they have much less capacity. I hope that one was clear. Then there's a set of questions about KEMSA, and maybe you could speak to the role of KEMSA in guaranteeing the Buy Kenya, Build Kenya. So KEMSA having the machinery for public procurement, KEMSA being able to buy locally, and why are they not buying locally? So quite a few of those questions. Over to you, Dr. Menge.
Thank you very much. I think the first question talks about what are we doing to ensure that we actually buy items that are made within Kenya. I had alluded to the answer earlier, where I had indicated that we are working with the Ministry of Trade and Industry to gazette the Kenya preferential procurement list. This is a list that will have products that meet 3 categories. Number 1, it has to be an essential medicine, and you'll allow me again to focus on medicines. The list also goes further to allow us to put all other health products and technologies. So we developed that list from our essential medicines list and from our essential medical supplies list. So if we can be able to have it in the essential medicine list, secondly, if we can demonstrate capacity. And I think there's a question that is asked within the question and answer. Do we have the quantities? And I'm glad to say that we did a forecasting and quantification for all our public health facilities. And that is a public report. You can actually see the actual quantities that they need. The report that we have currently runs up to this year. And you can be able to see what are the quantities that are needed for the various health products and technologies in all the counties and all the public hospitals or the national referral hospitals. So the second thing is, if we can be able to demonstrate that we have the capacity to meet our health needs, that is the second thing. And the third thing is that in order to be compliant with the Public Procurement and Asset Disposal Act, we need to have at least 3 manufacturers who are producing that product, otherwise will be a foul of the law. So if we're able to meet those capabilities, then your product will appear in the preferential procurement list, and we can only engage public facilities and obligate you to be able to purchase from only that. So that is one of the initiatives we've done. The second overall question talks about KEMSA, and you'll allow me to answer this very carefully. But KEMSA earlier this year, did make an advertisement, and the advert was closed to Kenyan manufacturers. And therefore, again, we've looked at the preferential procurement list, and I believe that the report we got before the close of the financial year was able to indicate that 67% of the products, 62%, of the products in KEMSA are procured from local sources. We will try to put the structures in place that will enable that to be something that you can be able to do continually. So those are two very specific initiatives. The other thing that we've done with significant success is to really engage the private sector. And you will attest with me that many of the people have said that as government, we have reached out to the private sector. It was always the private sector reaching out to the government. But all of these evaluations we've done together with the private sector. and therefore we are listening to their needs. And I think if you'll allow Charity, I'm going to make a request that because this report has really been asked for, maybe our next webinar, you'll allow me to just share the findings of this report so that it's in the public realm, and I can be able then to allow everybody to understand what is it that we have found locally. Over.
Oh, brilliant. I think, are there reactions to this in this Zoom? Let me see those claps and those thumbs up for the release and the discussion of the report. Yes, exactly.
Charity, can I add something to what Tom said? Yeah.
Yes. Yeah.
I think KEMSA has been buying locally. Yeah, as Tom said. So I think we should not say KEMSA is not good. KEMSA is good. The problem with KEMSA that the local manufacturers really face is that we don't mind supplying to them, but the payments are an issue. And that is not their fault. I think the counties have bought a lot, counties are not paying, and the government is not paying. So I think it's like any good business, when it's trapped up in a cash flow situation, that's what happens. So I think one thing is that they are giving more and more to local manufacturers. Yeah, so I think that's a positive point. I think I saw certain things about costs. Yeah, again, there was a study done about locally made and imported products, the cost. And it proved that about 80% of the products made locally were in fact cheaper than imported. Yeah, so these are the things that are there. Yeah. The second thing is, why is the local uptake not very much? I think like Dr. Kikombe said, we need to study the supply chain between the manufacturer to the Wanjiku who gets it. We need to really understand that. And I think that's where the answer is going to be. Okay.
Okay. Thank you very much for that. I hope the team at Private Sector Engagement Program is taking note, because these are requests coming direct from the industry, and also that the contents of the chart. So I will go back to a few more questions. I think we've been here for an hour, so I will just, thing is, we have engaged with this forum for quite a bit, and I promise you that this is only one of many. So we will come back to it. There's a question about raw materials. Maybe somebody is interested in the provision of raw materials. Can you comment about the availability of raw materials for your production in Kenya, Dr. Vimao?
Okay, so Africa has been talking about raw materials a lot. Yeah, I believe that the raw materials will come once we have local buying of finished products, and I'll tell you the reason why. Suppose FKPM members got together or individually made raw materials locally. Yeah. If they demand for that raw material and there's no duties or tariffs are imported, where do you think they'll buy? We just mentioned that the volumes are made so much overseas, they can reduce those costs. They have export rebates. Who's going to buy a Cosmos API or a Universal or Dawa or etc.? They're not. So first, let's create an environment where locally made products are accepted. Stop the imports. Let's create that trust and that market shaping. Then they say, okay, the next step is we're going to do this with raw materials in the next 5 years. Then it's a different story. Yeah, that's my personal. India is a classic case. In '63, medicines were imported. They stopped the importations. They told multinationals, put your factories here, employ Indians, and they encouraged cottage industries to come up. And then after a while, they started making locally made APIs and stopped importing because the demand was there locally. We need to do the same here. We need to do the same for what Bangladesh did. That's when it's going to start coming.
Yes. Okay, thank you very much. I would like to also say hello to Jacodu, who is one of our KHF board members. I see you're here. I know supply chain is your forte. Karibu sana. Why are you buying locally made products, Jacodu? Why not? How are you going to do better?
I'm majorly in the IVD space, basically the lab equipment and reagents and everything else. So maybe in the next session we'll be able to also want to hear, as much as the pharmaceutical industry is at 20%, what about the other IVD space, the diagnostics? So how badly are we doing, or how good are we doing? Because I think it's a space that is also quite neglected, and it is an area that was very essential during COVID. So maybe this was a pharmaceutical space, but I think I see a lot of Cosmos products that we buy once in a while in the pharmacy.
Good. Thank you very much,
you.
Jacodu. I see also quite a few comments in the Q&A saying thank you very much, Cosmos. Your products are very well packaged and very effective despite the price. So a double thing there, but thank you very much. So I think I see a lot of comments and questions, but I feel like we have addressed a lot of the issues that are being raised up here, because how are we addressing the wow factor? So that we are not always going for, imported products. Why are we still, if we have, I see this more as a reaction to, I didn't know we had this many things in the country. Why are we still importing? I think the question of importation is coming up. And I think there is space for importation, but I think it is just that balance. How do we support our local manufacturers? There's also, go on.
Charity, I think there's an important thing regarding local manufacturing, okay? I think, we all know there's substandard and falsified medicines in the market, right? Now, one thing is a product that is packaged, right? And I always tell to people, sometimes you get a packaged husband and a packaged wife, and the father-in-law always promises, my daughter is a great cook and everything. When you get married, you realize she's not a great cook. So packaging is nothing, okay? It's part of it. I think the thing is to see it in action. Local manufacturers, PPB, or even people from the medical industry can come and see what's happening. Seeing is believing. Now, when you get falsified medicines coming from overseas or substandard, your hospitalization costs are going to go very, very high. That is going to be an extra burden to the government. So I think we need to also look at this intangible costs which are there, which you can't see right now. Yeah.
Yes. Thank you very much. I want to start winding up. I believe we have addressed quite a lot, and I think we have, this is the first of many conversations. So I think we already know what we are talking about in the next webinar, which is the report from Dr. Tom Menge that shows, really gives a detail of the assessment that has been carried out. We have been very privileged to be part of that process in support of the Ministry of Health and have enjoyed the leadership of Dr. Tom. So shall we begin with some closing remarks so that we can all end this very, very cold day very well. Dr. Tom, shall I will invite you to close the meeting. Dr. Theuri?
Yes, you'd like me to go first?
Yes, please.
All right. I think mine are two things. The first one is I've had the privilege of visiting quite a number of our local manufacturers. And what I can say is the effort that has been put into ensuring that one, quality is top, is quite commendable, all the way from the packaging that Vimal has talked about and the effort that goes into preventing medication errors through labeling, through different color coding is quite commendable. what I think there's an opportunity, where I think there's an opportunity is the accessorizing industries around local manufacturing. For example, carton makers have a business opportunity. All they need to ensure is that farmer grade packaging is consistent, because they will say we are making this, but the line machines on the farmer side will reject them because the quality measures are high. So that has been very interesting to observe. The other is the portfolio range that they do have registered, and what they are researching and developing is also very interesting to watch. And I'm really optimistic that this is going to look up in the next few years. Currently, I think we are contributing less than 3% of the country's manufacturing GDP. My hope is that by the end of this, we'll be able to have moved that to double digits, so that the sector is able to contribute meaningfully to UHC, but also to employment and other subsectors of the ecosystem. Those will be my closing remarks. I'd like to thank everyone who has honored KHF's invitation, our partners Halcyon and PS Kenya, as well as USAID, who made this possible. Thank you, and to our chairman who's in attendance and our board members. Asanteni.
Thank you very much, Dr. Theuri. So before I ask Dr. Vimal and then Dr. Menge to close for us, just a quick recap of what we discussed today. So we did have an overview of the pharmaceutical local manufacturing sector, where we saw that actually we have a lot that is manufactured locally, which is about 20% of the items in the essential medicines products. And so we did have discussions later on of how to get to the how to increase that number. We said that 67% of what is currently manufactured is not in the essential medicines list. And part of this has been a factor of that knowledge availability. So then Dr. Menge did explain that the ministry has done a very good assessment report that looks at a lot of these aspects, from the capacity utilization to quantification to human resources and some of the challenges. And it is this report that we are saying will form the basis for our next webinar. We then went to look at why are we buying locally, why are we not buying locally, and what could be done. I want to say thank you very much for all the people that put their comments to what could be done to help you to buy more locally manufactured items. And we looked at the cost, and that is basically the cost to the manufacturer. We also looked at the wow factor. I like that phrasing very much, that if it is imported, then wow, and we are we don't investigate it any further. My personal comment was about having a quick identifiable marker that this is Kenyan, but also very good comments and interactions in the chat about how to educate people, how to ask the doctors to write it in the right, in a way that even a patient who doesn't know how to ask for it at the pharmacy can do. We had what I take as the invitation by Dr. Vimal to visit the factory, so that we can see a group of people that can then be witnesses towards this. So I feel we had quite a good and very interactive conversation. Thank you very much for keeping available. And so we'll just hear some final remarks from Dr. Vimal, and I will ask Dr. Menge to close for us. Asanteni sana.
Charity, thank you very much, Tim and Dr. Kikombe and Tom and everybody. Thank you for attending this. I think this was something exciting for me. I had got a lot of things prepared. Maybe I will be called next time. But there comes in your lifetime that you need to now start giving to the society. And I think we're in that stage. And I'm going to look at what Tom said in terms of the essential medicines list, and I'll get my membership to look at it and see why we're producing 20%. I think that's an eye-opener. I think the other thing we need to do is we need to make ourselves more prominent awareness to the population of Kenya that this is what we do as FKPM. These are what we manufacture, and take the myth away that imported is best. Yeah, I think Kenyan is best.
Yes.
Yeah. Okay. So thank you very much, and I really like this, and I like comments coming from doctors and things like that, because it only makes us better when we see from the others' eyes outside in the market. Yeah. Thank you very much, everybody. I really enjoyed it. Thank you.
Karibu sana. Thank you very much.
Thank you very much again for attending this. I just want to pick up a few things. The first is the challenge that should be taken up by the Federation of Kenya Pharmaceutical Manufacturers and the Kenya Healthcare Federation to encourage visits by prescribers to the factories in Kenya. I think we need to market our products to the potential users, and that will increase the confidence. I believe it's going to be taken up. There was also an issue that was asked about diagnostics and how much are we doing? And I believe that later on this year, we'll be doing an assessment for the other HPTs and find out how well we are, and we'll be able to give that answer then. Our commitment as the directorate, we will continue to engage the private sector. We will involve you in the things that we are doing. And during the launch of the documents that we launched last year in October, the president himself made a statement, and he did say that he wants that by 2026, 50% of essential medicines or essential HPTs are locally manufactured. And for me, that was what he gave me as my focus of what I commit to really strive to do. And just to note that all the manufacturing is done by the private sector. And therefore, it is of essence that we engage the private sector in all the activities so that we can be able to achieve, to ensure that 50% of our HPTs are locally manufactured. And thank you so much, Charity. And since you asked me to close the meeting, thank you everyone for attending. Thank you.
All right. Kwaherini sana.
Bye. Thank you. Good night. I mean, not good night. Have a nice evening. Yeah.
Thank you.
Bye-bye.
Bye.